Hello, Journal Club. How are you? This is Ron, and I've got an article that I think fits under a category of community assessment. And albeit we're going to make certain assessments of particular populations that are consuming dairy. Title of the article, Dairy Intake and the Incidence of Common Cancers in Prospective Studies. And these prospective studies are then going to be laid into a meta-analysis, and we're going to make some sense out of this. Here's the bottom line that current evidence suggests that dairy intake is associated with increased risk of prostate, ovarian, breast cancer, and a reduced risk of colorectal cancer. This comes out of the International Journal of Disease Reversal and Prevention. Milk is packed with important nutrients. You've got proteins, you've got calcium, vitamin D, and there could be some fortification of some other vitamins as well. We consume dairy. We regard it as an important staple, particularly in our community. And the government recommends dairy as part of their food pyramids. It's something that's affordable. We're talking milk, cheese, yogurt, butter. And there are other examples of dairy as well. And we're going to find out that there is significant evidence by this paper indicating that dairy consumption can modify cancer risk. And as I said, we're going to be covering prospective studies. This is important because cancer remains a leading cause of death in many countries. And we're in the business of trying to advise patients as to what is part of a good, healthy, affordable, reasonable diet. The picture first will go to what happens when dairy consumption is compared with prostate, and are we going to increase any cancer risk? Well, we know that prostate cancer is the second most common cancer in men worldwide, and it's now showing up in men under 65. There's a series of studies done, the Physician's Health Study, the National Health and Nutrition Examination, Epidemiologic Follow-up, the European Prospective Investigation in Cancer and Nutrition, the ATBC, which stands for Alpha Tocopherol Beta Carotene Study, and the Japanese Public Health Center-based prospective study. All of them had quite good numbers of men. Let's take the European Prospective Investigation, 142,251 men followed for about 9 years, and they found that the highest dairy protein intake was associated with a 22% risk of prostate cancer compared to the lowest intake. Let's look at the Japanese Public Health Center study. 43,435 men between the ages of 45 to 74. Dairy products were associated with a dose-dependent increase in the risk of prostate cancer. And the other studies are somewhat comparable in terms of the relative risks and the confidence intervals of 95%. Now, some of the this data from these 5 or 6 prospective studies were then put together into a meta-analysis. They were all rated to be as fairly good quality with low risk of bias, and they were found to demonstrate positive associations between total dairy product intake and the risk of prostate cancer, relative risk as high as 1.09 to 1.68. And another meta-analysis gave similar results with a 23% increased risk of prostate cancer mortality. And you can see the relative risk and the confidence intervals for the highest versus the lowest consumption. The mechanisms are thought to be through IGF-1, which is insulin growth factor 1, which is stimulated by ingredients in milk. Observational studies have demonstrated a positive correlation with IGF-1 and cancer risk. Calcium may also be dropping vitamin D. Vitamin D in this particular case is rather protective to the cell. So that's another hypothesis. And the third is that drinking dairy brings up estrogenic effects. Pregnant cows are milked, and this is when estrogen levels are at their highest, and this estrogen is able to bind to the prostate, activate uh, estrogenic receptor alpha, which has also been linked to prostate cancer. So we've got a mechanism and we've got a meta-analysis that is deeper than the prospective studies. The breast cancer studies were showing the same sort of a pattern. I'll only highlight the last two. The Adventist Health Study followed 52,000 pre and post-menopausal women from no dairy to high dairy, followed them over an 8-year period, and the higher intake of dairy was associated with 50% increased risk of breast cancer. Cheese and yogurt didn't appear to be to have an effect on the risk. And this China caloric biobank study, which had 300,911 women. They were followed for 11 years, and there was also a positive association between dairy and breast cancer. Ovarian is the second most common GYN cancer in the United States, causes more deaths than any other cancer of the female reproductive system. And they demonstrated strong correlation as well between uh, milk consumption and doubling even the risk of ovarian cancer. The Nurses Health Study was also in that same category. They thought that when lactose breaks down to galactose, there's an interference with cell signaling and ovarian apoptosis, which is how cells commit suicide, therefore leaving increased proliferation of ovarian neoplasia. The colorectal relationship between dairy consumption did not hold up. There was an inverse relationship there. And so we conclude with these following questions. What message do we convey to our community about the benefits or risks of dairy products? What will the dairy industry or lobbyists say about research that conflicts with their bottom line? And how difficult is it going to be to try to persuade people to change the habits that were received by mother and grandparents? I remind you that the authors of the paper are all from the Physicians Committee for Responsible Medicine, run by Dr. Neil Barnard, and they happen to be an organization that believes in evidence-based science, but they're also very much into vegetarian and vegan consumption. Thank you for your attention, and see what you think about the questions that I posed to you.